Many of us likely know people who believe that consuming certain substances improves their thinking or other abilities. However, when considering the potential effects of such substances, we often overlook important factors such as dosage, age, or genetic predisposition, making it largely an individual matter. Nevertheless, today we will examine whether and how some substances can actually enhance mental abilities or provide other benefits. Alcohol. First and foremost, it must be emphasized that due to alcohol abuse, approximately 88,000 people die annually in the United States alone. Globally, this accounts for 3.3 million deaths per year, nearly 6% of worldwide deaths. Regular consumption of even small amounts of alcohol shortens life expectancy, increases the risk of heart disease, and leads to many other harmful effects. Long-term, heavy drinking can also lead to brain shrinkage and white matter loss. However, according to the Harvard School of Public Health, in the case of moderate alcohol consumption, which is no more than 2 drinks per day for men and 1 for women, alcohol slightly reduces the risk of coronary heart disease, stroke, and diabetes. Interestingly, red wine has not been shown to provide additional benefits beyond those associated with other alcoholic beverages. These are still relatively modest arguments in favor of moderate consumption. It's important to consider them in the context that, from a societal perspective, alcohol damages the brain and lives of more people than any other substance. Caffeine is one of the most commonly used stimulants. In the United States, 85% of adults drink coffee or other caffeinated beverages. Caffeine reduces feelings of fatigue and drowsiness, shortens reaction time, improves mood, concentration, and physical coordination. It is so effective that many professional athletes use caffeine at regular intervals during competitions. In a 2016 study, participants consumed neither caffeinated or decaffeinated coffee, and then they were assessed in memory and executive planning tests. The results showed that after caffeine intake, there was a significant improvement in planning efficiency, creative thinking, and memory. However, it's important to remember that with caffeine consumption, there can also be side effects such as insomnia, headaches, anxiety, irritability, and tremors. Therefore, it's essential to dose it appropriately according to one's needs. It's worth mentioning that there are already several apps available to help with caffeine dosing, some developed by specialists like biotechnologist Dr. Jacques Reifman. Marijuana, as a medicinal substance, or its active components, have proven effective for some people in relieving pain, nausea, vomiting, as well as in treating seizures or symptoms of post-traumatic stress disorder. However, some studies suggest that chronic marijuana use during adolescence can lead to a decrease in IQ and permanent deficits in intellectual abilities. Nevertheless, there are also opinions that the causality is reversed, and it's simply that people with lower IQs are more likely to engage in chronic marijuana use. Furthermore, the more regularly a teenager uses marijuana and the stronger it is, the higher the risk of developing schizophrenia. However, it's worth noting that marijuana is one of the few drugs where an overdose does not lead to death. Tobacco is toxic. Smoking also significantly increases the likelihood of developing cancer, stroke, coronary heart disease, lung diseases, and many other causes of premature death. In the United States alone, smoking is the cause of nearly 500,000 deaths each year, which is roughly 1/5 of all deaths. However, nicotine itself is a somewhat different matter. Like many addictive substances, it increases the level of dopamine in the brain, a neurotransmitter that can sharpen attention, intensify reward-seeking behavior, and enhance the fluidity of voluntary movements. This is why smokers have been found to have a 3-fold lower risk of developing Parkinson's disease compared to non-smokers. Nicotine sharpens attention and memory, and can slow down or delay the progression of mild cognitive impairments associated with Alzheimer's disease. In another study, it was even found that a nicotine patch releasing a low dose of nicotine reduces impulsivity and improves memory in people with ADHD. All of this is interesting because nicotine can be consumed without smoking, for example, in the form of patches. However, it's worth mentioning that, for instance, Paul Newhouse, the director of the Center for Cognitive Medicine at the Vanderbilt University School of Medicine, commented that although previous studies indicate some potential beneficial effects of nicotine, especially in patients with mild cognitive impairments, we still need a better understanding of its long-term clinical impact. And recommending nicotine patches to anyone would be premature for now. Dietary supplements. There is no compelling scientific evidence that products sold as dietary supplements to enhance cognitive function actually work. If their manufacturers were able to prove this in randomized clinical trials, they would submit the research results to food and drug agencies to register these substances as full-fledged drugs and reap billions in profits from their sale. Instead, they slip through the regulatory cracks established for dietary supplements, which do not require evidence of safety or efficacy and are content with making millions. In the United States, such dietary supplements often contained unlisted substances, and the doses of what is listed are sometimes greater or smaller than they should be. An example was the dietary supplement ephedra, which is no longer available because it proved to be too dangerous. However, in the 1990s, it could be purchased in any store or gas station and was promoted as a study aid. Subsequently, several professional athletes and others who took it died, with many reporting harmful effects. In 2004, the U.S. Food and Drug Administration withdrew ephedra from the market. Prescription stimulants. As an interesting fact, it's worth mentioning that this phenomenon mainly concerns the United States. A whopping 6% of American high school seniors use prescription stimulants at least once a year to help them study. Among college students, this figure rises to 10%. Among Ivy League university students, it's 20%. The two main drugs are Adderall, containing amphetamine salts, and Ritalin, containing methylphenidate. These are typically used as medications to aid concentration and support learning for children and adults with ADHD. In people without ADHD, they increase attention and focus, allowing for longer periods of activity. However, a common side effect is the potential for paranoid states. In the British military, permission to use stimulants by soldiers was withdrawn 50 years ago because paranoid delusions among people with easy access to weapons were unwelcome. Therefore, it's important to be aware of the potentially dangerous effects of such substances, especially since a similar, though not as potent, positive impact on cognitive abilities can be achieved simply by being well rested. Many thanks to our patrons who allow us to cover more controversial topics. If you don't want to miss any future episodes, please allow notifications.